Okay. We'll come to the next presenter, that is Nandita Trivedi.
Everybody is absent.
This is she will be presenting scleral contact lens in complex corneal situations in a tertiary eye care center.
Good afternoon, everyone. I'm Dr. Nandita Trivedi, and my presentation is on scleral contact lenses in complex corneal situations. Scleral contact lenses are wide diameter, rigid gas permeable systems that vault over the whole cornea. Based on the size, they can be divided into semi-scleral, mini-scleral, or large scleral contact lenses. Let's have a look at the quick fit guide. The first step is to select the lens size based on the limbal clearance. The next step is to look for the central clearance. This is based on the sagittal height. The next step is to look for the peripheral edge alignment, and the final step is to do over refraction for the patients. Now, the uses of scleral contact lenses, it can either be used to improve the visual outcome of the patients, or it can be used to improve the quality of life of the patients. Here is a case series in which we are discussing various case scenarios for which scleral contact lenses have been prescribed in our setup. This is a case of 24-year-old male who was diagnosed with an overlap of PMCD with keratoconus, and for this patient, the acceptance TILC was performed, that is, both eye tuck-in lamellar keratoplasty was performed. Post-operatively, acceptance was 618 in both the eyes, which improved to 69 in the right eye and 612 in the left eye with scleral contact lens trial. Discussing various case scenarios of keratoplasty, a 27-year-old male underwent right triple procedure in 2019 for central leukomatous corneal opacity. Post-operatively, the vision with acceptance was 660. The RGP was unstable and scleral contact lens was given, and the vision improved to 66. Another case of a 40-year-old male who underwent TPK for left perforated corneal ulcer. Post-operatively, the vision was 4 by 60. With RGP, the vision improved to 618, and with scleral contact lens trial, the vision further improved to 66. A case of 14-year-old male who was diagnosed with both eye keratoconus, and in the right eye, DALC was performed. In the right eye, the vision post-operatively was 618. There was lens drop was noted with RGP, and on scleral contact lens trial, the vision improved to 69. Discussing a few rare cases, a 32-year-old male, he underwent LASIK 10 years back, and he had been complaining of diminution of vision since past 2 years. And on serial topography, we noted steepening, and a diagnosis of post-LASIK ectasia was made. And RGPs were unstable in this case, and with scleral contact lens trial, the vision improved to 66 in the right eye and 69 in the left eye. Another unusual case in which a 45-year-old male, he had a history of RK in both the eyes in 1994, and he'd been complaining of diminution of vision in the left eye since past 8 years. On keratometry, flattening was noted, and a diagnosis of progressive hyperopic shift was made. And on scleral contact lens trial, the vision improved to 66 in this patient. Coming to an unusual case of unilateral Tedian's marginal degeneration with 360-degree involvement, the vision on acceptance was 660, and with scleral contact lens trial, it improved drastically to the, 66. For cases for improving the quality of life for the patient, an 8-year-old male presented with Steven-Johnson syndrome, and he had severe dry eyes on presentation. He was unable to open his eyes, and the patient improved drastically with scleral contact lens trial. A case of 11-year-old female who developed corneal ulcer after using traditional medications in both the eyes, and glue with BCL was done in the right eye and Tenon's patch in the left eye, and the patient presented with severe dry eye, and the patient improved symptomatically after scleral contact lens use. So discussing the pros and cons of scleral contact lenses. It provides a regular surface of fluid which helps with the astigmatism, and this fluid reservoir helps to protect the ocular surface, and it can be used in various peripheral corneal ectatic disorders. However, in case of scleral contact lenses, there is a learning curve associated, and even though the life of scleral contact lenses is longer, these are fragile, and the patient needs to take care of their hygiene, and they are comparatively a little expensive. For our setup, which is a government tertiary care setup, it is very important to counsel the patients, because when it comes to the patients, they look at the price factor and they do not focus on the better visual outcome associated. Thank you.
Thank you. That was a very good presentation. I just wanted to know that patient with severe dry eye,
Yes, ma'am.
how did he tolerate the contact lenses?
Ma'am.
Because they are quite big.
Yes,
The
ma'am.
contact lenses are pretty big. He already has severe dry eye. Did he agree there was some improvement?
Yes, ma'am.
Not very much improvement in him.
Ma'am, the patient improved drastically because of all the keratinization of the lids. The patient had a lot of foreign body sensation, so we have prescribed him sterile contact lenses, and we are giving eye lubricants along with it, and the patient is pretty happy with the result because it's a young patient.
I agree. Okay, anyway, thank you.
You use the same brand Scleral contact lenses in every case?
Yes, sir. Yes, sir.
Okay, sir.
And you mentioned about the cost factor. It is a significant factor.
Yes,
believe me.
ma'am. It is a significant
Because
factor.
I have some patients who have sent for scleral contact lenses to someone else, and they at first refused to
Yes, ma'am.
take them because of the cost factor.
Yes, ma'am.
Because they said, and then that girl, she was around 21, 22, recently married, she lost one. So you can imagine
Yes, ma'am.
the financial burden.
Ma'am, in our setup, roughly we are giving contact lens trial for roughly 25 patients a month, but only one patient is buying because of the cost factor. So
Correct.
in this case series, we've included only those who have bought it and who've been using
have
it for
been
6
using it.
months.
Correct. Thank you.
Thank you, ma'am.